all you gotta do is relax that right shoulder and then bring your chin up a little bit. There it is. Do you hear that?
Yes.
Okay. So in regards to where you're feeling it the most, where do you feel it at right now?
Oh, definitely in here, on both sides.
On both sides.
Yes.
Here. Okay. And you can feel it kind of at the base of the shoulders,
Yes.
or the base of the neck here. You said that the both sides, but your right side a little bit more?
Right, yes.
Okay. The numbness, where do you feel the numbness at? Is it down into the arms?
It goes into the arms, yes.
Okay. Which hand, do you feel like it all fingers, or is it more so on one more than the
It
other?
feels more like on the
On
fourth finger.
That fourth
yes.
finger. Okay, gotcha. All right. And then the numbness, how often would you say that occurs?
At least a good 2 days a week.
Okay, a couple days. Does it last for a while, or does it kind of come and go?
Come and goes.
Okay, gotcha. All right. Now you did mention that you do get the occasional lower back pain. Where
yes.
does that usually feel?
It's usually, well, I feel it right in here.
Uh-huh. Okay. Okay. Well, let's figure this out for you. So we're going to get you scanned. And again, we're going to do this each and every time you come in.
Okay.
So you can see exactly how things are doing, how things are doing. I'm like shifting around in here. Yeah, so right off the bat, right there. It's the base of the neck right there. Okay. Okay. Now I know you said this recently kind of flared up, but you said it's been going on since like 20 years ago?
Off and on, yes.
Off and on. Yeah. Got some pressure up on top. Alright, so again, we're just measuring for the inflammation, finding out where that pressure's at. And each time you come in, we're going to see how things kind of shift around. Hopefully we'll get some reduction of some of the pressure that we're seeing. And so over time, we're going to keep measuring to see how things are progressing.
Okay.
Okay. Alright, so I'm going to take a look at the lower back first.
Mm-hmm.
This is your L5, right side joint. L5, right side. Any pain on those?
Discomfort.
Okay, would you say this one right here, L5?
Yes.
Yeah. Okay. Okay, so yeah, so we definitely have some pressure on that L5. A little bit lower here, so it's 1, 2, 3, 4. Here's T5, 6, 5, 4. Any pain on those ones?
Just discomfort on the 6 when you
The
said.
6, right on this one right
Yes.
there. Yeah. Okay. And the last one we're going to take a look is the neck. Alright, so this one's C6,
Mm-hmm.
C7, 1.
The 7.
On the 7 right there, yeah. Let's take a look at the motion here. So I'm looking for the restriction area right there on that right side. So that does not want to bend over to that right side. The left side's not terrible. Right side is where you feel it gets stuck there. Alright, so 7, 6, 1, 2, 3, 4, 5. Tilt you over to the side here. Yeah. Okay, so T6. Okay, and then L5. Okay, let's go into here. Is that 6? And right there is C7. So when I do get that joint to move, sometimes you can hear the popping noise, okay?
Okay.
So let's see how that does. It's just the gases in the joints. We're not cracking any bones or anything. It's just the gases get released from the joints.
Okay.
And that's why you hear that noise. So let's see if we can get some pressure off in there. Perfect. And a little bit right there. Good. And all you gotta do is relax that right shoulder and then bring your chin up a little bit. There it is. Do you hear that?
Yes.
Okay. Bring up the right arm for me. And let's get you with your head here. Feet on the other side. You're gonna face that wall right ahead of you.
Face.
Yep, just like that. Perfect. Okay. So, with that one here, let's bring the bottom leg straight. Perfect. This one's going to go right on over here. Perfect. Good. This one's going to come down just a little bit. Perfect. And this one right there. Good. All right. So this one's going to be your L5 right on that lower back here. Relaxing right there. Bring that leg up. There you go. And really just a little bit here. There you go. Relax that shoulder. There you are. There you go. There it is. Good job. Okay, coming up. We got one more. Let's get you on this table right ahead. Good.
All right.
Yeah, good adjustment so far. So both feet right on that platform. You're going to face the table. And this one's going to be 1, 2, 3, 4, 5. You got your T6 right there. All right, so breathe in for me. Relax the shoulders, temple. There you go, there you go. Oh, good job. Oh, that was great. Okay. All right, Veronica, come on over. Good. How's that?
Oh, that feels good.
Good. All right, so how did you do with the mid and the neck here? How did that feel?
Oh, it felt very relaxing.
All right, good.
That pressure felt off.
Good. Yeah, and that's what we want. We want to see if we can get some pressure off of that spine, really reduce some of that tension on the muscles. And a lot of times as we get some of the pressure off of the spine, those muscles, they're trying to guard your spine. They're trying to protect your spine. So when we start easing up some of the tension on the structure, those muscles oftentimes will start to relax, and that's what we want. Good. Yeah, that's reducing a little bit there. Good. And lower. Nice. One last one here. All right, not a bad start today. Okay.
Yes.
So, we got some homework for you, okay?
All right.
All right, so first things first, let's talk about what we did. So, the first one that we did here, that's going to be your C7 down below, okay? Now, this is, again, where you're seeing a lot of the straightening of the spine, but the joints, they've started to wear out, okay? So that means that they're not moving very well, so those joints are not functioning as well. So that's where the degeneration and arthritis will start to come into play.
Okay.
So with that, we're trying to push the spine forward so we can start to see if we can get some pressure off it, getting that spine to move a little bit further so we get a little more curvature in there, okay?
Okay.
Now with that, we also did your L5. Again, your spine kind of kinks over to that right side. We're trying to close that down so it can start to straighten up a little bit.
Okay.
And then the last one, we did that mid back here. Again, this is where your spine kind of shifts to the right again and kinks back to the left. We're trying to straighten that out as well.
Okay.
So with that, so you can feel some pressure to become relieved. So some of that pressure coming off of the spine, but at the same time, when we start moving those joints, your body's been this way for years. So when we start moving those joints, it's going to start to shift, move, and change. So your body will start to go through some changes in the sense that you can start feeling some tension on one area, some relaxation of the other parts. Just let your body kind of go through that process, okay? To help with that, walking is going to be your best form of exercise.
Okay.
Do you do much walking?
I do.
Okay, good. So 15, 20, 30 minutes, we can get some walking in. That allows that body to allow the spine to shift and move and change.
Okay.
Now with the change, sometimes you can feel some soreness. Okay, so ice is your best friend.
Okay.
15 to 20 minutes, get an ice pack, put a paper towel around it, ice those areas that you might feel some tension here.
Okay.
And then the last thing is, how's your water intake?
It could be better.
Okay,
Yes.
good, as we all can, right? So they say you want to try to drink about half your body weight in ounces. So whatever you weigh, take it, divide it by half, and you want to try to get to that many ounces, okay? So that's going to be it for today.
All right.
How are you doing?
Oh, doing good.
Okay, good. Well, I'm glad that you're here.
Thank you.